What happens on the day of your egg retrieval? Hi there, I'm Dr. Jen Fitzgerald, naturopathic doctor, and today we're talking all about what happens on the day of egg retrieval. Leading up to the egg retrieval, you've gone through ovarian stimulation, and then the last phase of that is the trigger shot. The trigger shot helps to time the egg retrieval, and generally the egg retrieval happens about 36 hours after the trigger shot. On the day of the egg retrieval, you'll be asked to come to the clinic about an hour or an hour and a half prior to the procedure. They'll let you know not to wear any makeup or jewelry or scented products. Maintaining really good air quality in the lab environment is critical. Either a nurse or an anesthesiologist, depending on the clinic, will review your medical history and they're going to insert an IV. Depending on where you are having your procedure, the procedure might be slightly different. In the US, it's really common to have it under sedation. So you're kind of asleep or taking a quick nap while the procedure is done. While in Canada, we do something called conscious sedation, where the patient is awake but kind of unaware of the procedure. They'll ask you to empty your bladder and walk you into the operating room, and that's where they're going to administer the medication to make you feel sleepy. The procedure is done under ultrasound guidance. So a transvaginal ultrasound probe is used, just similar to cycle monitoring. That way they can visualize the eggs within the ovaries. Then a very fine needle is inserted through the vaginal wall into the ovary. The doctor then aspirates or suctions the fluid out of each individual follicle. The egg is within that fluid in the follicle. So the fluid is collected into a little test tube, and then that's handed over to the embryologist. The embryologist looks at that underneath a microscope, and they're able to count how many eggs were in the sample. At this point, depending on the plan, the eggs can be frozen or they can be fertilized. The procedure itself is pretty quick. It takes about 15 to 30 minutes. Once the procedure is over, you'll be taken out to the recovery area and you'll wait there for your medication and sedation to wear off. Once that's done, you'll be released to go home to wait for the updates from the embryology lab.